The first phase of elective surgeries is trying to target those that are outpatient surgeries, so patients that can come in, have their surgery done, and go home on the same day. Those cases are typically going to be gallbladders and hernias. We're also trying to target the patient population that has either recently had their cases canceled because of COVID or are young, healthy, and not a lot of medical problems.
After you see your surgeon and make your decisions to come in for surgery, your surgeon will arrange for you to have a COVID test.
So 72 hours or more before their surgery, we'll have them tested. And then we would like them to stay either at home if possible, or if they do need to go to work, to try to adhere to strict social distancing guidelines so they don't potentially pick up anything during that 3-day window. So when they walk in the doors, they're going to be screened with a set of questions asking about symptoms and travel history. They're going to see everybody masked and with eye protection. They're also going to be asked to wear a mask themselves. The hospital actually provides masks for every person that comes into the hospital. These may be cloth masks that have been made within the community and donated to the hospital, but we do not expect patients to bring their own mask.
After the screening process, you'll be taken into the pre-op area so that we can help you get ready for your surgery. Once it's your turn to go back for surgery, things will look slightly different as you go back into the operating room, because we are taking added precautions with lots of added PPE. Most of what we do still remains the same as what we've always done.
We don't anticipate that you would come in contact with anybody that is positive for COVID. The unit in which patients are being treated for COVID is isolated and away from the surgery center. So the risk of transmission is low for anybody coming in for elective surgery. Hospital-wide, we have a no visitor policy except for minors. Minors can have one parent with them. All other patients are going to be asked to give a contact number, and we'll contact them when they're ready to be discharged. And that's just to try to limit people coming in and out of the hospital that may be asymptomatic carriers of the disease. We've taken a lot of extra precautions to try to prevent any potential spread of disease to any healthy patient coming in. And I think that we can make this as safe of a visit, even safer than going out into public to get groceries. I'm very confident that our surgery department is ready for elective patients to come in and not have any increased risk. As we start to implement phase 1 of starting elective cases, we'll also continually be monitoring the community cases. If we start to see a rise in cases, we'll be in close contact with the KDHE as well as our own county health department. And if we need to back off and do less elective cases to try to decrease the risk, then we'll do that.